So, talking today about psychoactive drugs and how these can influence your state of consciousness. Okay, so first in classifying drugs, psychoactive drugs are any substances that are capable of influencing perception, mood, cognition, that's thinking, remember, or behavior. So we'll talk about psychoactive substances today, and one thing that I want you to keep in mind is that when we're talking about drugs, it's not always going to be about illegal drugs. We will talk about several kinds of drugs that are legal, right, but are definitely capable of influencing these different areas. So we'll talk about each of these four types of drugs: stimulants, depressants, opiates, and psychedelics. Okay, so stimulant drugs. Stimulant drugs speed up activity in the central nervous system. So remember, the central nervous system consists of the brain and the spinal cord. Examples of stimulants include nicotine, caffeine, cocaine, amphetamine, and methamphetamine. And stimulants produce these feelings of excitement, confidence, jitteriness, and anxiety. Depressants do the opposite of stimulants. They slow down activity in the central nervous system. Depressants include alcohol, tranquilizers, and barbiturates. Oftentimes the latter two, tranquilizers and barbiturates, are prescribed as treatment for anxiety. Alcohol in small doses can function as a stimulant, right? You might start talking more than you would normally. It's, called the social lubricant, right? But in large doses, alcohol actually is a depressant. And these drugs function by reducing anxiety, guilt, tension, and your inhibitions. So you might do things when you are on these particular substances that you wouldn't do normally. Other kinds of psychoactive drugs include opiates. Opiates basically mimic endorphins. So remember, endorphins are those chemicals that your body produces. They are endogenous chemicals produced by your body, and their basic function is to reduce pain and produce some kind of euphoric experience. Examples of opiates include opium, morphine, heroin, and methadone. Psychedelic drugs work by altering your perceptual experiences. So remember, perception has to do with how you take in information in the environment using your five senses. Examples of psychedelics include LSD, mescaline, and psilocybin. These drugs might produce hallucinations. Most common are visual hallucinations. A hallucination is a false sensory experience. So a visual hallucination includes seeing something that isn't there. You could also experience auditory hallucinations where you hear things that aren't there. Olfactory, smelling things, gustatory, tasting things are less common as hallucinations, but sometimes you may also experience tactile hallucinations where you feel things that aren't there. And this happens with some other drugs as well, particularly with stimulants, particularly meth and cocaine, where people who take them feel like there are bugs crawling all over their body, and so they'll pick at their skin to try to get the bugs, and sometimes they think the bugs are crawling beneath their skin, and so they're picking to try to get at those hallucinations. So some drugs then fall outside our neat classification system. So for example, marijuana, some individuals classify as a mild psychedelic because it may produce hallucinations in some individuals. Other people say that it's a mild stimulant because it increases your heart rate. But additionally, it produces this relaxation, euphoria, and increased appetite. So it seems to kind of defy classification. Another drug that falls outside traditional classification, MDMA or ecstasy. The chemical structure of MDMA is similar to methamphetamine, which is a stimulant, and also to mescaline, which is a hallucinogen. And effects of MDMA, it produces this sense of euphoria, of self-confidence, and of heightened sensory perception, particularly tactile perceptions. So how then do these drugs work on the brain? So let's take one example here of cocaine. And cocaine works on the brain by basically making more of these neurotransmitters, dopamine and norepinephrine, making more of those neurotransmitters available to your brain cells, to your neurons. So remember when we talked about how neurons communicate with each other, and we said that they communicate via chemical messengers, particularly those neurotransmitters, dopamine and norepinephrine are examples of neurotransmitters. Dopamine is responsible for learning, and it's also responsible for reward, right? So it makes you feel good when you do a particular thing. So cocaine basically overstimulates production of these particular neurotransmitters that make you feel good, makes them very, very available in your brain, and that is what produces that euphoria, that sense of intense pleasure. And then when the drug wears off, you don't have the same normal levels of these neurotransmitters in your brain, and so the individual experiences this crash after they take this particular substance.